essentially they had milkmaids that were milking the cows, and they were noticing that the milkmaids weren't getting smallpox. So they attributed it to the fact that there were some sores on the udders of the cows caused by this virus called cowpox, and that was conferring some protection. So they, in that time, were actually just taking the open sores from cowpox and either ingesting it or somehow getting it into their bodies to generate this immune reaction. But they didn't, like, the science wasn't established at that time. There wasn't any germ theory. They didn't know about viruses. So what Edward Jenner did was kind of demonstrate that more at an empiric scientific level. My name is Neal Goldstein. I'm an assistant research professor in the Dornsife School of Public Health at Drexel University. I am an infectious disease epidemiologist, and that means that I look at diseases at the population level that are caused by organisms and can be spread from person to person. And I work in two broad areas. The first is HIV, and the second is vaccination and vaccine-preventable diseases. Vaccinations have a very interesting history. They have been around for hundreds, if not thousands of years, and they work by the principle that exposing individuals to some kind of organism or piece of that organism can induce an immune response. But the difference between vaccinations and, say, being exposed to a disease outside in the environment is that vaccinations give you all the benefits of being exposed. That is, you will get immune to the disease without any of the harmful consequences that would go along if you actually got the disease. Why are we talking about vaccinations now? Well, a lot of people attribute this to being victims of our own success. And what I mean by that is vaccinations are probably the best intervention that we have in public health. The reason I think we're having this conversation today is people aren't aware of the diseases that vaccines prevent against. I mean, how often do you hear of somebody having diphtheria or tetanus or polio? And so subsequently, we think that we don't need to be vaccinated anymore. But in fact, these diseases still exist in the wild, and it's not that we may encounter it in our local environment, but certainly if we travel to an area where these diseases are endemic, we need protection against that. Or if travelers come into the area that we are, we need that kind of protection. We're seeing these pockets of under-vaccinated and unvaccinated individuals that have this susceptibility to the disease. And so you have a disease like measles, which is no longer, in fact, endemic in the United States, but you have imported disease from travelers, and that can get a foothold in these unvaccinated and undervaccinated areas and really spread around quite readily. So the idea that people don't want to vaccinate themselves or their children is not a new concept. In fact, it's been around really as long as vaccinations have been around. It even went as far as the Supreme Court of the United States in the early 1900s, around 1905 or so. And the Supreme Court of the United States ruled that it is absolutely constitutional to have a mandate for vaccination. And that's a fantastic thing, because with vaccination, we really need a high level of immunity to protect individuals against disease. You may think that vaccines only prevent disease in yourself, but in fact, they prevent disease at a community level. So this works by a concept known as the herd effect or herd immunity. And the idea is that if you are protected against disease, you're one less opportunity for some harmful organism, a pathogen, to infect you and then spread to other people. So the more individuals we have vaccinated in an area, the more that we have this reservoir of protection in that community. Some people cannot get vaccinated for valid reasons. These are called medical reasons, and these could be things like you have a severe allergy, you are immunocompromised, you are being treated for a disease and are on chemotherapy. For these individuals, they definitely need the protection that is afforded by vaccinations, and they rely upon the community for that protection because they themselves cannot get vaccinated. So it's important for us in public health to acknowledge that vaccination is not perfect, and there are some risks associated with it. If you look at the risks, they are incredibly rare, and for the most part, the side effects of getting vaccinated are pretty minimal. This may include some redness or some pain at the injection site. In children, some of them will go on to have a fever. And in the really rare case, among those children who are not treated for having the fever, they may even go on to have a seizure. But let's contrast that to the complications of getting the disease itself. So for something like chickenpox or like measles that you may think, I want to naturally get the immunity to this rather than having vaccination, the complications to those diseases are incredibly serious and in some cases as extreme as death. When you do the cost-benefit analysis of this, it is so heavily in favor of getting vaccinated. And the unfortunate few that have the side effects from this, for the most part, those will be very manageable, very treatable, and be very transient in nature in that they won't last for a long time. Whereas if you get the disease, the complications that arise from that could last a lifetime.